Hello everyone, greetings from Learn TV, the channel dedicated to the latest trends in learning and development. I'm Philip and I will be your host today. In this episode, we're welcoming Ms. Haifa Daoud, who is an internal auditor at Johns Hopkins Aramco Healthcare and a resilient compliance specialist with over 10 years of experience in healthcare quality. In addition to being a certified internal auditor candidate, she is also a certified lien agent, a certified occupational health and safety specialist, as well as a certified enterprise risk specialist. With her today, we will discuss about 5 trends in internal auditing and risk management in the healthcare industry. Now, Haifa, welcome to the show. It's a pleasure to have you here today.
Thank you so much for having me. Absolute pleasure.
Haifa, we would like to start by explaining to our audience what the internal audit process is like in the healthcare industry.
Yes, starting off with what is healthcare generally? What is internal audit generally? Internal audit is an independent objective assurance, and it's a consulting activity that is designed to add value to an organization and improve its operations. So having said that, and due to the diversity in healthcare, audits that can be carried out in healthcare are many types, whether operational or financial. It could be information systems audits. So it's just like any other company. The types of audits that we perform can vary between compliance-based audits or risk-based audits or other types of audits, basically based on the nature of the audit itself. So the whole process is performed by initially understanding the department's operations and comparing their policies and procedures that should be ideally set based on best practice in relation to the required compliance standards and regulations and demands. But answering your question on how is internal audit different in healthcare than in other organizations, whether it was a manufacturing company or if it was a bank, whether it was a public or private company, at the end of the day, our ultimate goal is our client's safety. And in healthcare, our client is the patient, of course. In addition to other goals, which could relate to reducing financial losses or ensuring that privacy and confidentiality are maintained, or ensuring that resources are not wasted, on top of other things, of course.
Following the previous question, why are internal audits so important in healthcare?
Internal audit generally is all about locating high-risk areas in the organization when it comes to its operations. And it's also about finding a potential opportunity that could lead to risk and then auditing them. So this will help the healthcare organization to more efficiently determine where its resources should be allocated by, for example, identifying areas where potential fraud can occur and setting controls in place to protect multi-million-dollar assets that are used across the hospital, whether it was MRIs or any other medical assets or clinical assets. Or most importantly, to ensure that our inpatients and outpatients are receiving the plan of care that they need or they have based on their diagnosis and based on the set goals of their multidisciplinary team. And most importantly, making sure that the physicians who treat these patients are credentialed and privileged physicians. In addition to, of course, setting other levels of control that would help have less medical, legal, and litigation cases filed against the hospital. So it's basically all about improving the system rather than detecting errors by bringing a professional level of objectivity and independence in the organization.
What is the main difference between internal audit and risk management in this field? Can we make a clear distinction between them, or are they interconnected?
Well, as much as internal audit and risk management are interrelated, they're functionally and administratively two separate, if you may, functions. Risk management, at least in healthcare, is an act of performing and developing and implementing. And in healthcare, it mainly looks at, we call it occurrence variance reports or conducting RCAs on incidents if needed. They look at near misses and adverse and sentinel events, whereas the audit function is an act of overseeing and assessing existing controls and seeing whether these controls are effective or needs enhancement. So this hugely depends on the organization. Let's say organization A has a mature ERM framework. The audit function can then use information about the organization's core risks from its ERM framework as one of the core inputs to its audit plan. Whereas organization B, on the other hand, doesn't have a mature ERM framework, or let's say its framework is still in its initial levels of development. So then this means that the internal audit is forced to undertake their own risk assessment. In other words, risk management has to develop the risk management framework, whereas the internal audit is all about auditing the adequacy and effectiveness of the risk management framework. And our role here is to provide assurance to the management and to the senior management, and to the board, whether or not these frameworks are adequate and effective.
Within your extensive experience, you're constantly following the latest internal audit and risk management trends. Can you share with us some of the current trends in the healthcare industry?
Yes, of course. Well, there are a few good trends out there, I'd say, based on research and based on what's been going on recently in the audit industry. I believe the number one trend would be artificial intelligence. This trend is only likely to become even more prevalent for internal auditors as more organizations of all sizes and sectors initiate automation programs. So it's been a swiftly accelerating trend across most areas of businesses across the globe. But at the same time, it's bringing risks and challenges to overcome alongside its benefits. So as internal auditors, our role is to help integrate governance and control and risk management across automation initiatives during the transformation or the change that is made for such processes or such artificial intelligence programs. This is the first trend, I believe. As a second trend, privacy audits. I'd say privacy audits are becoming key components of internal audit plans. And because of the consequences of failing to comply with global data privacy regulations, privacy audits are expected to be conducted more across organizations, whether it was a healthcare organization or any other organization. We all know that privacy and data protects mainly all the data that's mentioned in the department or in any hospital. The second trend, I'd say, is privacy audits. Privacy audits are becoming key components of internal audit plans. And because of the consequences of failing to comply with global data privacy regulations, privacy audits are expected to be conducted even more across organizations. We all know that privacy and data protection is growing more complex each day, especially with everything being systemized. So keeping patients' records private is essential. And organizations could face substantial penalties under the HIPAA and privacy and security rules if those records were not securely maintained. So internal audit must think strategically about privacy and how the organization handles and protects sensitive data. Organizations that perform frequent privacy audits can reduce costs by millions. So such audits will definitely help organizations mature their privacy programs. Cybersecurity is the third trend, I'd say. Cybersecurity has always been a persistent threat to organizations and companies, especially in healthcare. Patient data is more valuable than other information, whether it was credit card information or any other information you could think of. So hackers can access private patient data. Not only opens the door for them to steal the information, but also to either intentionally or unintentionally alter the data, which could lead to eventually serious effects on patients' health and outcomes. So organizations are starting to recognize the need to create a line of defense that can provide an independent review of security and to identify opportunities to strengthen these protection measures. More insight is being demanded also by management and by the board into cyber risks, since it's increasing and devastating businesses across the globe. So our role is to assess cybersecurity policies and reports on the effectiveness of these security programs and provide opportunities for advancement. This will also help stay aligned with the core cybersecurity regulations. So these are the top three trends I'd say for auditors to do or to add in their plan. But the fourth trend is more of, it's a bit different, and it's more into the inner circle of the internal audit department and somewhat merged between diversification and credentialing, in alignment with proper training and applicable certifications for auditors to be able to perform their job with high quality. So imagine having an audit team that consists of one from an accounting background and one from an IT background, one from a healthcare background. This team will be able to contribute innovative thoughts and different ideas and solutions. Having auditors with different backgrounds will definitely impact the company's culture across the board. Additionally, it's very important to ensure that your team is enrolled in different trainings to be able to keep up with what's been going on in the industry and identify areas for improvement in each team member and sending them to these trainings accordingly. My last trend is somewhat related to risk management, which is using accurate data to manage your organization's risk appetite. So your organization needs to have the correct and most importantly needed and accurate data to be able to utilize it in managing its risk appetite. And as we know, risk appetite is generally known to be the risk exposure amount or the potential adverse impact from an event that the organization is willing to accept. So once the risk appetite threshold has been breached, risk management is implemented to bring the exposure level back within the acceptable range. So I believe, at least from my point of view, those are the 5 trends going on now in the healthcare industry for audit.
Do you feel like some of these will change or become obsolete in the future?
Well, I'd say that nothing stays the same, leave alone this era we're living in where there's something new coming up every day. So it's very important to adapt to the changes, and with these changes come new controls that has to be set. I'm going to give you an example from my day-to-day job. So you can't, for example, perform an audit using the same testing methods when a specific function was manual and has now changed to electronic. Same thing with these trends, and especially with what's been going on here in Saudi Arabia with this whole transformation program and the 2030 vision. The healthcare is one of the top focuses of transformation in the country, where the vision is to have a healthcare system that basically promotes and protects and restores the health of both individuals and the society. And this will only be done by implementing its mission, which is transforming the health sector in a gradual and safe and efficient manner to ensure that the system is dynamic. And that technology is enabled. So as we know, technology keeps evolving. And because of this evolution, the trends will definitely change.
You're currently part of Johns Hopkins Aramco Healthcare. Can you tell us more about your role there?
Yes, our role as auditors is mainly to help the organization accomplish its objectives by bringing a systematic and disciplined approach to evaluate and improve the effectiveness of 3 main things: risk management, controls, and governance. When I say controls, I mean control environment, the control activities, the information and communication, and the monitoring of these controls. And as for the third point, which is governance, under governance, our ultimate responsibility is to evaluate it and to improve it. And how do we do that? By formally assessing its processes while still remaining independent.
With your experience there, have you become aware of any new trends that internal audit and risk management professionals should follow in this industry?
Yes. Well, in addition to the 5 trends I just mentioned, I believe culture audits will be a huge audit trend. As much as auditors may find culture to be a theoretical concept, as it is subjective by nature, but the risks from culture audits are real and can be quantified. And efforts to do so work particularly well over time. Culture has always supported business strategy and must be actively understood and managed. And the risk to culture occur when there is a misalignment between the organization's values and leaders' action and between the employees' behaviors or organization systems. Culture is also a source of legal and reputational risk, which is really important in any organization. So internal audit can help management and the board drive the right culture by mainly setting the tone at the top and sending the right cultural messages and aligning incentives with values, which is essential in today's ongoing digitalization and intense media. And at the end of the day, we need an overall program for managing culture based on the practical framework.
What is the best way our viewers can get on board with the latest trends?
Well, if you're an auditor, I believe reaching out to your National Audit Society will be important. Your audit society will share with you the latest trends related to audit. I believe also familiarizing yourself with the IPPF audit standards is very important. Familiarizing yourself with the ERM framework set in your organization would be helpful. Also, there are many external workshops from accredited and credible organizations that are being provided in person or online. And you can also follow pages on professional social media, but all in all, you must not be disconnected from the industry.
What are the essential skills to be developed in order to do so?
There are many skills that can either be inherited or acquired, but critical thinking and professional skepticism, I believe, are very important. And I'd say the most important and essential skill in this field is communication skills. And as much as communication skills is generic, but believe me, having strong communication skills as an auditor will help you definitely in your career. At the end of the day, we're humans, and this is what we do best, communicate. So leave alone communicating in relation to audit observations to a client or communicating audit observations to management. In fact, the ability to articulate a clear point of view on the issue is core to an attribute that clients value the most. Another skill, I believe, is emotional intelligence. Emotional intelligence is a significant mechanism that moderates the effects of different types of pressure on auditors. And I believe the last skill is somewhat a technical skill. I'd say data analytics. It's a very important skill for auditors. A big part of auditing relies on data and statistics. So it will definitely enable you to do so while you're confident and will help you extract accurate data, which will enable you to take better decisions.
And Haifa, last but not least, what can be considered as long-term goals for professionals in your industry?
Simply put, I believe to increase the operational efficiency and risk management and regulatory compliance, in addition to, of course, being a certified internal auditor and probably have a more specific certification like a certified environmental health and safety specialist. And hopefully on the long run, be a member of one of the audit boards. So I believe that's it.
Haifa, thank you so much for this great discussion. It was a pleasure to have you on our show.
Thank you for having me. This was nice.
A big thanks to all of our viewers as well for tuning in and staying with us until the very end. If you want to follow more topics and discussions, make sure to follow us on LinkedIn for our daily episodes. Don't worry if you've missed something, you can always watch it again on our YouTube channel. And until next time, stay tuned.